Welcome to PHR-Rescue. Support this new technology and help turn the healthcare system upside down. My name is Newt Malerman, and I won't bore you with my medical history, but suffice it to say that in a period of 5 years, I landed in the hospital for 7 operations. In that time, I learned a lot about the confusing medical establishment. I wrote several books about how to get out of the hospital alive. The books are chock full of common sense to help navigate the puzzling medical establishment and how to get the best possible health care. So, what's the big deal about the flash drive? Let me tell you why I invented this device and how it just might save your life. PHR stands for Personal Health Records. My 7 surgeries involved my family doctor, a urologist, a physiologist, a gastroenterologist, and several imaging devices, all at 3 different hospitals. Now here's the shocking truth. None of these medical facilities could access my medical history at any of the other practices. I realized that I needed to take my medical history with me from practice to practice. I took a proactive role in my own safety and health care, but that turned out to be just the tip of the iceberg. Every doctor, every test facility and emergency room that a patient goes to asks them to turn out the same forms time after time. A waste of time? Certainly. And worse, it was probably inaccurate information. How many of us can remember just how to spell the name of that new prescription or the dosage? Nor can many recite their doctor's phone numbers. With PHR-Rescue, I filled out my medical history one time, then gave the printout to each facility I visited. You know what? They loved it. They quickly saw my allergies, my past surgeries, my prescriptions, and my over-the-counter drugs. It saved them time and helped them give more accurate health care. We all know that most doctors somehow manage to have illegible handwriting. Picture what happens in an emergency. A hospital calls one of your doctors for information about your allergies and medications. A staffer goes to find your records, leafs through, trying to find the data needed. Is your stopwatch going? Maybe the needed information is at one of your other doctors. Say that your information is quickly found and faxed to them, but all this time you're in severe pain. With PHR-Rescue, all your vitals from whichever doctor are quickly accessed and organized in clearly printed, easily read order. So who needs PHR-Rescue? Patients who need more than one doctor. Elderly people who frequently forget their medications and other vital health care data. Caregivers, especially for mentally disabled or patients who have memory problems. Disadvantaged populations who frequently have no control over who administers their health care and who are less familiar with medical terms and procedures. People who drive and those in hazardous occupations. More about that in a few more slides, but first, some danger warnings. Medical histories have become popular targets for identity thieves. They can be sold for far more than Social Security numbers. Although we have engineered our forms in PHR-Rescue to remove all of the saleable data, we still take extreme measures to foil identity theft. A copy of our privacy and security statement is available on our website. PHR-Rescue medical histories are not stored up on a cloud somewhere. Clouds have been hacked, repeatedly hacked. Very sophisticated clouds have been hacked. Apple, Target, all of those clouds have been hacked. With PHR-Rescue, only you decide who sees your data. Even if you lose your rescue drive, there's nothing there to give away your identity. There are several free health record services. They do cost you nothing, but your demographics are sold, bringing big bucks to the sponsors. PHR-Rescue does not sell your demographics. Your data, not stored on a cloud somewhere, is automatically organized and entered on your rescue drive by our copyright-protected program, unread by anyone, including our staff. For this crowdfunder, our immediate project is to develop and deploy health forms for pads and mobile phones. We have set a modest goal of $1,200 for this purpose. Your funding will help us to realize our dream of making healthcare easier and more accurate for potentially millions of people, and we're happy to recognize your significant efforts to achieve this. Please support this effort to get this important startup idea going. If we should raise more than our goal, we will be able to do so much more. If you go to our website, you will meet our staff. The doctors, nurses, and educators mentioned, as well as the president of the company, are all volunteers. We get no salary for our work in behalf of this idea. Read all of the inspiring stories and open your hearts to this vital idea. Thank you for watching this video, and thank you for your participation.